Cool. So today we're joined by Luke Moir, who works for Zoological Society of London, and is going to be talking to us through the general stages of rescue and rehabilitation of marine megafauna, based on his experience as an animal carer, with a focus on seals, sea turtles, and seabirds, and then a commentary on the challenges to overcome and ideal strategies. So yeah, I'll hand it over to you, Luke. Take it away.
Great, and yeah, thank you for inviting me to do this talk. Before I start, can everyone see my screen and presentation?
Yeah, we can see it.
Excellent, and I don't have an ability to view Teams right now and things like that, but so if there are pop-ups and stuff, so yeah, if people have any immediate pressing questions, feel free just to shout at me. I'm used to it. But yes, my name is Luke Moir. I'll be going through some of the major stages of rehabilitation of aquatic wildlife. So in this lecture, we'll go through some of my background and experience, not too much because I don't really like talking about myself. The rehabilitation stages, facilities, zoonotics, and general conditions and general care that these animals should be receiving. This is part, more of an edited down version of a guest lecture series I do for the University of Padua, so we won't get into handling or individual conditions too much. My main goals for this lecture is just to teach two things really. One, seals aren't cute, despite the lovely photos I'll be uploading, and that rehabilitation is quite tough work. And just a heads up, some of the images are quite distressing, so I will be trying to give a heads up whenever we get onto those. For those curious about me, I grew up in Northern England, Scottish family, hence the really messed up Scottish Geordie accent. So I do apologise for those of you that can't understand me. I did my bachelor's in marine biology from Newcastle University and my master's at the University of Padua. I have been mainly based in the UK, but also the Netherlands and the Maldives. Previous job experience includes working as a ranger in a seabird colony in the North Sea, consultant in kelp restoration, lead marine biologist in coral restoration, aquarist in many aquariums, outreach, and various other jobs. Basically, I've accidentally done all of marine biology. Right now, I'm working as a zookeeper in London Zoo. Although nowadays I mainly work with corals, it was actually the rescue and rehabilitation work which was my specialty. So moving on in, there are a few main stages of rehabilitation. Some of these blur depending on the patient and the facility, but this is the general skeleton I found. Step one, rescue the animal. Step two, the assessments. Then you go through stage one, stage two, stage three, and then the release. And I'll expand on that in a second. But first, we'll go into the rescue side of things. So this is a bit of a call and response here. So here is an example of one of the places I worked, which was Scarborough Sea Life, which has a seal hospital right there in the Yorkshire coast. And we're going to enact a call I have received from a member of the public. I'll tell you what, Sarah, we'll pick on you for this one. Are you ready, Sarah?
Yes.
Okay. All right. So imagine you are me at Scarborough Sea Life, and a call comes through. Ring, 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 ring. Hello, is that the seal people at Scarborough Sea Life?
Yes.
Yes, hi. I'm just down the beach, down near Filey, and there is a sea lion in the water, and it seems to be drowning. What do I do?
Me? I don't know.
That's not very reassuring. So that's one of the first things. You have to get a bit more information about the situation and try to work out exactly what the person is saying, because in that call, which I have received before, if there's a sea lion in the water and it's drowning, first of all, we don't have sea lions in the UK. What we might have just spotted was a seal in the water, and it's definitely not drowning. So you have to ask yourself, should you help in this situation before anything else? You know what? We'll see if we can redeem you, Sarah, in this one as another call comes through. Ring, ring.
Okay.
Hello, is that the seal people at Scarborough Sea Life?
Yes, it is.
Hi there. There's a seal on the beach and it's looking a bit poorly. Its breathing is funny. It seems to have blood coming out of its nose. It's all by itself and it seems to be young. Are you able to come and take it?
Yes. Is that
All
the
right.
correct answer?
Well, how would you know it's the correct answer?
I'm not sure.
Right, so a few obvious questions need to be asked first before the rescue can even begin. In that case, I asked first, where are you? And the answer was Truro in Cornwall. It's quite a drive for us to come pick up one seal, and there's closer facilities, so you can actually, you should try to establish a location first, just like any just like in paramedics, you have to establish the location and get as much out of the report as possible. Another example of a call I've had it was about a penguin that must have got loose from Scarborough Sea Life. This was that penguin. For those of you that don't know, that is a guillemot. It is native in the UK, and this one was particularly fine. There's nothing wrong with this penguin. So first thing, before the rescue even starts, it's dealing with the public and coordination. You can't really trust anything. People come to you in a panic because they don't really understand animals and have this idea that you can swoop in and save the day. Really, you should be asking, should you help? Can you help? When you get a report come in, you need to analyze and get the most out of it as possible. You have to have make sure you have the right equipment and staff available. Do you have the van available? Do you have right PPE? Do you have a capture method available and people trained in it? You have to establish the location. How accessible is it? A lot of these marine animals are by the coast, which tends to be slippy, wet, hard to traverse. The arrival time is, if it's going to take you 12 hours to get there, it might be worth giving a call out to someone else nearby. Try to work out exactly what is wrong with the animal. Most people don't recognize what is wrong with an animal. I've had people call up before saying there's something wrong with a seal because it's not making the R noise like in the movies. That's a sea lion. Most seals are actually quite quiet when they're not just growling at you. And chances of distress are there lots of people surrounding it with their dogs. That is an extremely dangerous situation and extremely stressful situation for it to be in. Do you have a vet that you can take it to that has the expertise to actually assess the animal? And most importantly, do you have the facility that can hold it if it is really sick and in need of rehabilitation? These are some of the questions you need to ask yourself before even setting out. During the call, what we ended up doing is making this call out sheet where we kind of have to first establish the location. What 3 Words is a great app. I recommend everyone have it. It gives basically a GPS coordinate where you are with, and just simply you can respond to paramedics or rescuers or what have you with those 3 words, and it's quite an easy way to get your location. For reporter details, get their phone number in case the line disconnects, or if you get there and you're not quite sure, things don't match up where exactly the animal was. Warn the members of the public to keep away from the animals because they are dangerous, and even if they're not, people can do a lot more harm just being around the animals than they realize, causing stress and conditions such as heart disease just from stress and their presence alone. From there, you need to establish the animal's description. What size is it? Are you going to have to come down with a massive giant crate or a little bag in order to pick up this animal? Does it have any identifying features or markings? So those of you that are seeing it can see that the seal has some orange dye on it. This is a vegetable dye that a lot of seal rescuers use to mark that it's already been assessed and that it was found to be healthy and it's been released. It's most likely that this seal is just trying to recover and rest before continuing on its way. From there, you need to establish any other conditions. I do not recommend asking leading questions. There's a completely different, you get completely different responses from people asking, is it breathing rapid or how is it breathing? As soon as you put the idea that an animal could breathe rapid into people's mind, if they don't have a baseline of what that is, they start to overthink and will give wrong information. Whereas leaving open-ended questions, they can give you unbiased opinions at least. From there, it's breathing, injury, any discharges, its positioning, is it seeming slumped and lethargic? Is it, you know, on its side, scratching its belly? Completely different scenarios, and whether or not other people or animals are nearby. Then we move on to the actual rescue and preparation. You work out the access to the site, the chance of disturbance. Make sure you gather your PPE as always, that you call in to wherever you're working from, that you're going to a dangerous location to handle a wild animal, and you have the right equipment. So to pick up things like seals, we tend to use large sort of banana-shaped bags if it's just a small one. If not, large seal crates work. For seabirds, we tend to use basically folded light boxes just to be able to put them in. Sea turtles, we tend to use these large fixed nets that basically supports them as we can carry them up from the side. A lot of these places around our coastline are quite remote and quite hard to get through. And as you can see, this is one of my own photos. This was the access down for to a beach. It turned into a waterfall. We had to go up and down that. That was very annoying and possibly dangerous. And this is another example I had of a seal rescue chilling on top of a World War II battery, covered in seaweed, and it was only about 4 meters across, and it would lurch and attack anyone that would try to climb up. Quite vulnerable position. It took a lot of planning to get that animal down. But once you do pick that animal up, you need to take it to a vet. This lovely photo is me holding down a seal during x-rays, looking very stylish there, I must say. The veterinary assessment will determine whether this candidate is fit for rehabilitation or euthanasia or release again. Vets are trained in ways we are not, and as much as a lot of animal carers would otherwise think they know better about certain things, it's not their call to make. It's a vet's call to make, and it's very important to understand that hierarchy and respect that medical knowledge. It's during the initial veterinary assessment that body condition, wounds are identified, temperature, and all these other conditions are monitored and then come up with a treatment plan. It's actually illegal to give medicine to animals without veterinary approval beforehand. So you need to see a vet straight away, otherwise you end up with an animal quarantined in an area getting worse without any hope of recovery, without illegal action, essentially. So the most important thing in my experience of rehabilitation and rescue of wild animals is the facility. It's not just the veterinary care or medical plan, it's the management of the food, the water quality, the hospital structure, the layout, the amount of light, temperature, the lack of disturbance, handling amount, and staff expertise. This is what brings an animal from likely to die in the wild to be able to be fit and ready and healthy enough to go back in the wild. The wild's an awful place. I'm not sure if those of you that been camping more than a couple of days, it's not great. There's a reason we invented the indoors. In order to get through rehabilitation, this animal needs to be completely healthy and behaving like a wild animal. Otherwise, it'll be thrown into nature and be exposed to horrendous stuff before dying slowly, unfortunately. So the amount of handling, for example, needs to be done properly and in a monitored way, because then you can deal with issues like institutionalization and being too friendly with people, which can cause so many issues. So for most facilities I look out for hospital design is for other individual units quarantined. Can you get inside without transferring diseases in and out of there for biosecurity reasons? Does it comply to food preparation standards and medical standards? Can it be easily cleaned and so on? Do you have a good amount of food and ready and available and good quality food for the animals as well? So for example, with seals, where a decent seal can get through 5 kilos of herring every day, you're going to need a big freezer. It seems obvious to say that, but then when people come to build these things without any prior experience, they often leave freezers out of there, things like that. Water, does it have access to fresh and salt water? How quick is it able to be filled up and drained? Are there areas in the hospital units that can be haul-out sites and so on? Does your facility have stored medicines and other disposables and that are secure? If you have a facility that has a lot of useful drugs for rehabilitation, it can become a target for theft, for drug abusers. So it has to make sure that it's properly secured. And the pen design itself is very, very important. My most important thing is that it can be easily disinfected by being cleaned down properly and quickly. That includes good drainage and having it been smooth. Something like fiberglass or tiles is very important. Otherwise, disease can build up. If you think about a pen a bit like a hospital unit, that is kind of what we're aiming for here, not necessarily trying to recreate their natural environments in the early stages of rehabilitation. And are these units observable? Can you observe the animal? This is particularly important during stage 1, where they get the highest amount of medical treatment, and they also get controlled energy inputs. By that I mean a limited amount of food, and all their food is tracked. It is recommended that these are quarantined, because some of them may carry diseases that are transmittable to the others, or diseases that doesn't rear their heads until later on in rehabilitation. The goal is to finish medical treatment and onto eating whole food by themselves. Most of the animals I've dealt with are abandoned pups and chicks, essentially too young to figure out how to eat for themselves. So it's during this stage that they get introduced to fish and are force-fed until they are able to eat for themselves. It is the most intensive in terms of labor and observation and handling and sanitation as any other stage of rehabilitation. Is everyone with me so far? Or am I going too fast?
I think we're good. There's lots of thumbs up if you can't see the.
I can't. All right. Well, yeah. Well, for this next, it's going to be another call and response sort of thing. So These are a selection of stage 1 units I have worked with or have visited, and I have different opinions on each one. Catherine, I will choose you next. I want you to tell me which one of these I like and which one of these I don't like.
Okay, the bottom left, I would say, is pretty bad because it's a really small space and it's been. Oh, is that good? Because you could fit a few in there. This is hard. Bottom middle is Is it good if they're together or apart? If they're sick, should they be separate? But is it good socially for them?
So in stage 1, I would prefer it if they were, yeah, no, that's right. So in stage 1, I would prefer if they were separate. Later on, we can introduce some socializing elements. It's also a bit more difficult in terms of handling in quite a small space. Imagine trying to wrestle a seal while another one's coming up behind you. So it does make it a bit trickier. So, but otherwise, that's quite a good unit. It's a bit spacious. There is a drain. It does have access to water. When it is filled, they can haul out on a bit of land there. So that's pretty good. It just so happened in that season there was an overwhelming number of seals, but the unit itself I don't really have a problem with. The bottom left you mentioned, it is small. Yes, it is. I am not quite happy. And imagine that seal, it's pretty chunky. Imagine stepping into that and needing to catch and wrestle it. You don't have a lot of room to maneuver. You're pretty much fighting as soon as you start leaning over. And we'll talk about the reasons why seals are not the cuddly, cute things everyone imagines soon. What do people think about the top middle one? Anyone feel free to jump on this one.
I'll just go again if no one wants to volunteer. So there's no water in there, but the drainage is good. As it's safer for the keeper because they can lean in and feed the animal without necessarily having to get in and handle it. But then, is there a haul out site in that pen, or is it all flat?
Nope, it's all flat.
Okay.
Another thing about this is that the walls really only go up to a child's shoulder. Now, in that room, there's a series of those next to each other, which means that if it is filled with water and the drain is blocked, then basically one splash, or in fact one big sneeze, and you've contaminated every other unit in that place. It is a terrible idea for a quarantine. It's also, you can tell, pretty silly for letting a child try to feed a wild animal. As an obvious point, it shows some priorities some places have. But no, exactly. So it's not got any haul out space, and as such, when you fill it up with water, it's all water or nothing at all. Whereas like in the top left and top right, those units, even though the top right does have a thin haul out area, it does have a haul out area so the animal doesn't have to run the entire time. Water in the early stages of a rehabilitation is a huge energy drain. It's a bit like being sick in the hospital and being forced on an exercise bike. Yes, for long-term rehabilitation, it's a great idea, but short-term, no, it's a huge energy cost. So not even being able to provide that rest for the animals to self-manage is pretty bad indeed. The bottom right, I also don't like because concrete and is really tough to clean and make sterile, I think. And it's also small, and the water provided is just basically a big bowl. I was not happy about seeing that sight. But no, very good. Thank you for that. Stage 2 we'll go into now. So it's here that we have follow-up treatment, increasing feeds amount, longer swims. At this point, I would recommend tagging them. Sometimes you can create social environments, as you can see with a picture of much younger me feeding a bunch of adorable seals that were trying to eat my hands. The goal is to try to get them to self-eat as well as reduce their dependence on us. So again, a lot of these animals come in and really I've noticed quite a few times they believe that you're the mother or that you're the source of food or your hand is the source of food. You start to, through proper handling and professional technique, remove them from that. You don't want to release an animal back in the wild that will approach a fisherman, for example, or a tourist and then get frustrated and attack. It's not great. And finally, we move on to stage 3. It's this stage where you're trying to get them up to weight in order to be released. It's usually external and much larger, as much space as possible. It's better if similar to the natural environment, but still maintained to a high standard of cleaning, not as much as the initial stages. Shelter could be a great idea, as well as hiding spaces, especially if it's a public site. Hygiene is still important. Reducing the stress amounts or reducing the amount you're getting in for is important. And at this stage, what I want is every time I step in, they either run away from me or are showing aggression towards me. That's when I know I've done a good job. I don't want them coming up to me looking all nice. And finally, we have for release. The important factors about the release are the weight of the animal. So for common seals, for example, you're looking around 30 kilos, greys around 40 kilos, and it's various for different sort of birds and turtle species. Where are you releasing them? Because an exposed beach in the middle of a storm is not a great idea. You'll end up just picking it up later. Then make sure that it is actually behaving like a wild animal. And you have to make the decision about whether or not to make the release public, although it could be a great source of education, outreach, and even income for a rehabilitation center. There can be problems. So for example, at a previous site I worked at, they did advertise once about one of our seal rescues, and the very same day, fishermen came back to the front desk and chucked the tags that the seal had onto the front desk after killing it. So you have to be aware of public sentiment and things like that. The next slide I'm going to show you goes on about zoonotics. So if anyone's not happy with the idea of blood and gross stuff, sorry. So most marine megafauna are capable of great physical harm and infectious diseases. Conditions are, some of them can be really bad conditions, but can be lethal sometimes. These can be transferred through the breaking of the skin, through feces, as well as other discharges, and come from a variety of sources. And it can also go both ways. So for example, during the COVID pandemic, we had to take further steps to protect our Asian short-clawed otters on sites because there was a chance we could spread COVID to them. So a list of diseases include seal finger, mycobacteria, brucellus, that big list of big fancy words I'm not going to go through. Seal finger is one of the ones I'm most afraid of. This is someone who, this is an image of it. Basically, it's two bacteria that occur if you get a single scratch or bite from a seal. And I've seen it happen without even breaking the skin. And within an hour, that finger can be swollen up and be deformed for the rest of your life. An hour after that, it can spread to your hand. An hour after that, it spreads to your arm, and it basically becomes blood poisoning. I had a nasty bite a few years ago, which I'll show a picture of once it's cleaned up. So this isn't the worst of it, but a seal kind of jumped up and bit through my finger and stripped off the bottom and top parts of the flesh, as well as my fingernail there was actually hanging off the other way around. Luckily, you can see it was cleaned up and it's healed remarkably well. I won't show you my middle finger, that seems a bit rude. But the antibiotics I was on were so strong because I was so afraid of seal finger that it was making me throw up blood. It's scary, some of the things you have to put yourself at risk for when handling wild animals. And these were only small pups for the most part. So take it into a great deal of caution. If anyone asks you ever to handle a wild animal or things like that, don't. We all have Google on our phone. You can Google the nearest RSPCA or Wildlife Rescue Centre and report to some of the experts that are trained to handle them with minimal risk to themselves or the animals. Actually, about that seal there, I went to work after A&E and I was feeling really bad about not being able to handle the seal and give it its food. I was talking to my boss and he said, all right, next day, let's come in and let's, make sure you're wrapped up and we'll try to get this, get the seal. And so you get that confidence back. I came in the next day and it was dead. I then had to carry its body and do a dissection right then and there, while, still bleeding from his hand, essentially. These are the sort of things you go through as part of this line of work. You can imagine it can get quite stressful and lots of nasty moments as well as really great moments. So it is important not to sort of dive in head first without an actual expert teaching the ropes. Speaking of actual experts, this was my boss at the time, the curator at Scarborough Sea Life, and as you can see, he may have taken the PPE a bit far. So when dealing with any wildlife, I recommend disposable gloves. And then mostly with aquatic stuff, I recommend, good overalls as well as boots / waders. For larger seabirds like gannets, I recommend goggles because those beaks can get quite long and even when handling them, they can still have a chance of hitting you. For sea turtles, a large but inflexible net is needed in order to support them. And whenever you are handling wild animals, make sure that you have all the appropriate equipment with you close by within arm's reach. The most important bit of equipment, and I cannot state this enough, the towel. Douglas Adams definitely got that right. Very important. Without it, could not do any of this job. Yes, some more filthy pictures. So in terms of general care and management of these guys, regular sanitation is absolutely essential. This is a seal 20 minutes after I cleaned it. As much as people like to think they are mermaid dogs, they are actually smelly, horrible slug monsters. I love them to bits, but that's what they are. They have no sense of cleaning or whatsoever, even compared to dogs or cats or what have you. They love rolling in filth. So you have to always be on top of it in terms of sanitation. Good instantaneous disinfectants I utilize is Safe4 and Panox. Try to minimize every visit and combine sanitation with feeding. Not only does that reduce stress, but also reduces the chances of institutionalization. Making sure that their diet is made to meet their nutritional needs. So for example, I mentioned herring earlier. To have that much herring needed for seals, generally you're dealing with frozen herring, which loses a lot of nutrients. So you can balance that up with aquatic multivitamins, as well as iron tablets and things like that. And it's important to weigh your food so you know exactly the energy input coming into the animals. As for force feeding is a tactic and is a skill. It's definitely a skill for each and every individual species you deal with. It's important to be well knowledgeable about it before first attempting it, because otherwise you can cause regurgitation as well as undue stress, and which will just further aggravate whatever situations we have, including causing things like heart conditions. And again, another obvious one is good record keeping. It's when you're dealing with complicated patients with complicated drug regimes and feedings and so on, it is important that you don't that you note down everything you do, so that if they don't receive double a dose or that there is too much handling of the animal. And this is another example of just how messy it can get. This was about half an hour after I visited that seal, and you can imagine an animal that's discharging so much blood as a lot of nasty things in that blood that needs to be kept on top of. For turtles, they're a bit more different to a lot of marine megafauna, and found quite rare in the UK, although cases are increasing. UV is a requirement as part of their metabolism. They tend to be warm because they are exotherms. They need warm waters. I recommend 25 to 28 degrees, although different species will have different requirements. Chlorine can be used in very low levels to help with sanitation. However, I recommend just using other filtrations or having regular water changes. Throughout their rehabilitation time, I recommend keeping them alone, not even in stage 3, because they can transfer some diseases, or seems some disease increases do happen, especially eye infections, which I'm not quite sure of the mechanisms of. They do not need a whole out site, and I'd recommend making whatever enclosure they're in circular, just to help reduce any sort of bashing as they move around. They can survive a really long time without eating, but force feeding can be done. However, I recommend I'm going to mispronounce it, osphagotomy. It's basically a tube placed in the stomach. I'm not great with the bigger words, I'm realizing. But yeah, that can be done, and that tends to be less harmful and completely reversible in most turtles if done right. For seabirds, you may need to add in some burrows depending on the species, such as puffins, but having a diverse amount of substrate is also very important. Hiding spots as well. Birds tend to be the most, excuse upon, flighty of all the ones I've dealt with. You don't really need purchase for most seabirds. Really just shags and cormorants really benefit from them. You can have water access if they are on a float and if they are waterproofed. And by that, it means their uropedial gland is working properly to keep the feathers waterproofed. Heat source is very important as well for these guys. They, if they start to go downhill, their temperatures crash, and they will go downhill very quickly, like most bird species, if there is an illness or a problem. I recommend for these guys, get them swimming as soon as safe, as soon as they got that waterproofing back on them, and try and get them used to that natural behavior and reduce time on their feet. Seabirds, it can be some of the quickest turnaround times in terms of rehabilitation I've dealt with in terms of marine megafauna. Another thing that I would say is more important with birds for compared to turtles and seals is aeration. Bacteria and ammonia will affect them a bit more than seals and sea turtles, and then you can get other issues such as bumblefoot, which don't affect the other two. And finally, we got another adorable seal. They, as the previous pictures have showed, require regular sanitation. Minimize every visit, I recommend, and well, most of it's already been covered by previous parts. So what I'll do is just go through some of the common conditions that you tend to see throughout all of them. which is early abandonment slash neonates. So this is a grey seal pup. You could tell it's a grey seal pup because it's nice and white and fluffy. Ideally, they should have 4 weeks with mum, by which time the white coat, the lanugo, is gone. However, seal mums don't really always have a choice with that, or have not read the pamphlet on being good mums. So sometimes they get abandoned early, which can lead to exhaustion and malnutrition. If you think about a lot of seals, for example, they only get a few weeks at most with their mum before being chucked into the North Sea and have to figure out what to eat, where's safe, while fighting off disease, while swimming in the North Sea is very exhausting. So they can burn through what little reserve they have very easily and end up sick, and malnourished and dehydrated. And that's a little puffling that was managed to come out of its burrow a bit too early, and was starting to lose in condition until we got that one. And next up, all of them seem to deal with a lot of ghost fishing wounds, bits of net and other fishing gear that have been abandoned. General treatment is removal, antibiotics, and cleaning. Debris ingestions, so microplastics and larger scale plastics as well, has been increasing rapidly throughout all of them. Usually you spot this with a diagnosis of a lack of appetite, as well as endoscopes, maybe some ultrasounds. It's predicted that plastics occur in around 1/3 of all turtles, 40% of all sea turtles, and over half of all marine mammals. Some will regurgitate and excrete, but some can be stuck in them for months, if not years. Another thing we see quite often is trauma. So this is an example of a ship strike. It's quite obvious to see in some of these, unfortunately. They can get some very nasty injuries, and because they are in basically a big soup of life, they can get a bit infected quite quickly. Also, internal parasites. So this is an example of a lungworm case in a grey seal. Lungworms are a nasty parasite that basically don't want to hurt the host, but if other diseases come in, a bit like pneumonia and things like that, they start to explode rapidly and cause massive damage and emphysema to the lungs, creating such a high parasite load for these animals. And finally, you've got eye infections. All of them seem to have quite a high amount of eye infections. I've dealt with quite eye infections in all of those species. And yes, those can be caused by UV damage, or trauma, or just infection as well. So hopefully you've not got sick of me, but I just wanted to read some conclusion bits. Yeah, wild aquatic animals do suffer various ailments, and these are actually increasing a lot due to anthropogenic activities, as well as development and expansion, increasing the chances of us finding them, but us also the amount of them being affected by these things. Successful rehabilitation can be done by following strict biosecurity, health and safety guidelines, animal care strategies within a well-set-up facility. Falling short of these can lead to excessive suffering for the animals, which is, should never happen. The work involved can be quite hard, even though I've got lots of fluffy pictures. But I just want to make the final point that aquatic animals, especially seals, are not cute. Except for Boo, who is a good boy, and that one bird I found, and when living on an island, that made me a Disney princess. But that is it. So I'll just close that there so I can see you guys again.
Yeah, thank you so much, Luke. That was really interesting. Yeah, it really stands out from a lot of the other talks that we've had. So we've got some questions on the Jamboard. I was hoping I can just read them out and you can like answer them in your own time. Is that
Sure.
cool? Great. So first, do you have to reconsider options for releasing migratory seabirds if the season has passed for their time in the UK? So, for example, for terns or shearwaters? I'm not sure if that's how you pronounce it.
Yes, but because generally most of the cases you deal with tend to be, you either deal with a lot of neonates at the beginning of the season as well as throughout the season. A vast majority of them you can, because of the turnaround time, release in an appropriate time. Although those that have come on the other end of the scale is, you have to look at weather forecasts and stuff, but a couple of cases I have held back until the next season.
Excuse me. Okay, great, thank you. And also on seabirds, are seabird rehabilitations more complicated in this period of increased bird flu?
Yes, although not just it's not just seabirds that get affected by bird flu. For example, at that site I mentioned, Scarborough Sea Life, we couldn't bring in wild seals because they can also be infected by what was the strain at the time, H5N1, and we had penguins on site as well. And our first priority is, of course, the animals we already have. So without a bird flu test to confirm, we can bring them in as well. It does make it more complicated. However, a lot of times, if it's a well set up facility, you can put in biosecurity controls and things like showering and changing scrubs between different units and places like that.
Oh, okay. Yeah, that's fair enough. Okay, next question. How do you suggest someone gets into rehabilitation, either as part-time or as a career?
Oh, don't. Did you not see my finger? I've got way worse photos. Are you kidding me? You're covered in crap while an animal's ripping your throat out. No, it's it is no, it's a brilliant cause and I love doing it. I don't know how I've moved away from it or why, but yeah, there's a few excellent sites I recommend looking at. So you can volunteer with certain things like the RSPCA in like West Hatch, for example, deals with more seals than the rest of the country combined. But one of my favorite places was, say, Hunting Centrum in the Netherlands. I've been there quite a few times as a volunteer and a part-time staff member, and a brilliant site. And they have an on-site campus for volunteers and stuff. Yeah, I really rate them.
Okay, great. Good to know. For a rescue call, would it be a good idea to get the public to send in a picture or video of the animal at a distance to help you assess the situation?
At a distance, unless we have a really good phone, it tends to be not worth it. And then asking them to get closer can lead to harsh interactions. Plus, it's kind of another thing which I didn't bring up there is for them to send like a video, you'd have to give up your own personal WhatsApp rather than, or something like that, rather than the office phone line, which a colleague of mine once did to the police for these cases and was called up in the middle of the night by a member of the public who was just forwarded on to him and then accused him of being Al Qaeda because he wasn't running down to pick up a seal that was fine.
Okay.
Yeah, so it's kind of, yeah.
That's an unusual example, but yeah. Okay, fair enough. Noted. Okay, and are there ever situations where you would not help or interfere with an injured animal so as to not disrupt the ecosystem further down the food chain?
Not necessarily because of that. No, not because of that. I mean, the food chain's got so many problems. I don't think rescuing one seal changes compared to a super trawler in the North Sea. That's, dismantling it. That being said, we're always open for guidance. In fact, there's constant discussions between rehabilitation centres right now in the UK in terms of taking grey seals, because grey seals are doing relatively well, whereas common seals are less.
Yeah.
However, I would be, not in terms of the food chain, no, but then that's where veterinary assessments, as well as like DEFRA guidelines and all these other things that feed into professional animal care centres and national strategies sort of come about. The only things I wouldn't necessarily interfere with would be if it's too dangerous for myself, or if I knew it was going to need euthanizing, in which case I would only assist with a vet with euthanasia.
Mm-hmm. Okay, got it. And next question, do you track the success of rehabilitation post-release? And if yes, how long for, and how does that vary by species?
Yeah, so it depends on the animal and the site that you've worked with, but most rehabilitation sites I've worked with will tag the animal in some way. So whether it's like a little cattle tags and the flippers of seals, which is inconvenient for lots of ways, because the flipper of seals is webbed and they often close it, so you don't often see it unless they're sunbathing and stretching out all of their stuff. But unless you have expense for real-time remote tagging, which most places that do this work, their first priority is, of course, looking after the animals. Having what, 2 to 10 grand budget for one tag doesn't quite work when that is an entire seals rehabilitation's cost for a month. And seabirds as well are part of large tracking programs all around the world, with ringing and so on. So not much difference there. Sea turtles, I've not actually dealt with any tags with sea turtles as of yet.
I guess with sea turtles, you kind of like, if you find them nesting, you can like record where they're, where the tag is from, things like that. But I wonder with seals, like if you found like a tagged seal, is that would like somebody have to report it as part of like monitoring?
Yes, so generally relying on public spotting and stuff like that. So you can basically, all of these tags tend to come with large thick numbers, and you can call, basically a lot of us that do it are kind of in the same network, and then, oh yeah, send us a picture, and RSPCA might send it to Sea Life, or Sea Life will send it to someone else, and eventually we'll find out who this belongs to.
Oh, okay, cool, super interesting. All right, and I think this is the last question. What animals are at higher risk of getting like used to humans, as it were? So, and how do you prevent this during rescue and rehab?
I think common seals are, in my experience, can be, very attached to humans, very needy, and whereas seabirds not as much, and turtles don't care. Like most reptiles, they're brilliant for that. Whereas seals, particularly common seals, are, in terms of that, get the job done as professionally as possible. Don't coo over them like they're your dog. They're not your dog. They're a sea wolf. They belong like a sea wolf. Just do the job and try to get them to disassociate you with food, and just associate you with the guy that occasionally bothers them with cleaning their room. And when they start to attack you, that's when you know you've done a good job. Okay.
Yeah, that's really interesting. Awesome. Yeah, I don't think we have any more questions. If anyone else had any, since we have a few minutes, like put them in the chat or Jamboard. But yeah, otherwise I think, thank you so much. That was super interesting.
Well, thanks for inviting me for this. But yeah, if anyone has any follow-up chats or questions, my email is luke.moir@cetazel.org. Feel free to message me on that. I'm happy to answer, because I love talking about my animals. So
yeah, of course.
Great, thank you so much, Luke. That was really good.
Oh wait, I think we have a question from Federica, actually. It's got her hand up. Yeah, if you just want to unmute yourself, go ahead.
Sorry. Yeah, I just wanted to know if there is any advice for ways to communicate with your veterinary team better, as someone that works in rehabilitation centers, whether every rehabilitation center does have a vet on site, or for those rehabilitation centers that don't have a vet on site, how do you overcome that issue? Thank you.
Yeah, depending on the site. So some do have on-site vet staff, and that's a brilliant luxury, I would say. Other times it's a mixture of, so for example, at Sea Life, we had a centralized animal health team that were experts in exotic animals, as well as having to rely on local vets for impractical procedure. In terms of that, just, yeah, in terms of increasing communication, constant communication, and just trying to make sure you select vets and partners that are interested in what you're doing as well, understand the mission, but you're open for their interpretation, but you invite them around as much as possible, that they feel welcome, that their voice is heard, and that you know, that they know that you know that they're in charge of in terms of the hierarchy, and that you respect that, rather than trying to go around what they want, or always arguing about decisions, and trying to feed into the shared knowledge together, because we're all part of the same team really, and it's good to have enthusiastic people that really work together. And that's what I did, and ended up engaging to one. So yes, got engaged to mine, so that worked. So I don't recommend that necessarily. That's a bit expensive, mind you.
Fair enough, thank you. Well, Nita's put something in the chat about local Peterborough seals who come upstream to non-tidal areas. Oh, there's a campaign against them by the local angling association. Oh.
Yes. Yes, seals going after fish in water. Oh no, what a problem. That's what they're meant to do. You know, it's a shame, but that's exactly what fishermen on the coast deal with. That is natural, that is normal. I know they are destructive and crafty things. You spend so much effort in making a lobster pot and come back a day after putting it out there and a seal's wrecked it. It is frustrating. Unfortunately, we are still in a country and where you can shoot them, despite them not being much of a bother, or they need to do a certain amount of damage. You can just apply for a license and shoot them, even though that is technically not allowed in certain counties. However, people still abuse that system by just crossing over slightly. It's so they have that. I think that is, you know, if you don't want seals in the water, then what else don't you want in water? We can't just pick and choose exactly what we want. Healthy oceans, healthy seas cause top predators to come and help balance it further. And the more of these guys we have in general, the healthier everything will come, even if it does come with a little bit of annoyance, personally.
Yeah, I think that that was made illegal in Scotland, I think, or only in some circumstances. I think to protect salmon farms, was it? But that was quite a recent.
Quite a recent one, but I know, for example, in England, in fact, again, seals don't care about borders. So Germany, Norway, and some places in Netherlands as well. We all in this North Sea basin, you know, they're vulnerable to being shot for living and the opportunity for an eating meal.
Yeah, well. Okay. All right, I think that's us at 2:00. But yeah, thank you so much again. That was super interesting, really engaging talk. And yeah.
Cool.
Cheers.
Right. Cheers there, guys. Bye.
Thank you, Luke.
Appreciate you. Thanks.
Bye.
Bye.